Massage is an ancient treatment and a natural reaction to pain. For example, rubbing a sore elbow or rubbing a sore knee. Massage has been accepted in the clinical setting without question, the evidence of its effectiveness being principally anecdotal and largely undocumented. The significance of therapeutic touch and the value of simple hands-on treatment for tendinopathy have become overshadowed by our changing approach to the pathology. Furthermore, increasingly sophisticated equipment is being used for assessment and treatment, and specific exercise protocols often negate the patient's chief concern, which is pain. And pain hinders the management of tendinopathy because patients are often reluctant to perform loading exercises when in pain. Even following patient education and pain education, there are many ways to reduce pain from musculoskeletal conditions, and while massage has received some bad press from academia for its overall lack of evidence, one thing research supports is massage as a tool for pain reduction for musculoskeletal conditions, although not specifically tendon-related pain. There is evidence to support the use of direct deep transverse friction massage, DTFM, on tendons to reduce pain, but this needs to be approached with caution against the backdrop of the continuum pathology theory. In my opinion, deep transverse friction massage might aggravate reactive tendons and cause an unhelpful increase in protein production. However, transverse friction massage often leads to a period of pain relief, analgesia, and a reduction in the size of any tendon thickening. Thus, some therapists continue to use this treatment. Based on current information, I recommend that deep transverse friction should only be used as a treatment option for stubborn, degenerative, chronic tendinopathies. So I would advise avoiding the temptation to rub acutely sore tendons. Massage has multiple alternative names that describe the style of the massage, the teaching school from which it originated, and the philosophy on which it is based. You may know, practice, or have heard of some of the following: sports massage, soft tissue release, myofascial release, fascial manipulation, trigger point release, transverse frictions, and instrument-assisted massage. In terms of tendinopathy management, you need to experiment to find which massage methods help to reduce your patient's pain and appreciate that these may be different between different individuals. An important point to reiterate before we look at massage options is the poor pain to pathology correlation. Massage treatment is solely for pain relief, and the reduced pain should encourage improved exercise adherence and load management. The effects of massage. The effects of massage are well known but fundamentally unproven. There are many debatable points that could form a lengthy discussion. To keep things brief, it's unlikely that massage increases blood flow, and even so, not in a way significant to benefit a tendon. It is most likely that the benefits of direct massage of a tendon are through desensitization from a short period of hyperstimulation. The benefits of massage are most likely to occur from an initial pain gating, and this is followed by descending inhibition, influencing the volume of the noxious input and a more global relaxation of muscular tone. Massage causes movement of the underlying tissue and fascia, which may improve the slide and glide between different layers and influence fluid flow and hydration between the tissues. Research has also shown alterations in the following hormones: cortisol, serotonin, dopamine, and oxytocin. This hormonal mix helps regulate many processes within the body, including immunity, pain perception, and injury recovery. There is undoubtedly a placebo effect and the building of rapport and trust with the patient that are vital to any successful management program. The following techniques are some of the recommended massage treatments for the lower limb tendinopathies. As we go through, a quick note about testing. Before performing a treatment, it's very useful to pre-test a painful movement and then retest it after the massage treatment. This also allows you to determine how long the benefits of massage last and when further treatment ceases to improve the outcome. As a result, you should be then able to select the most effective massage options for each individual patient. As we have a look now at some massage options for lower limb tendinopathy, you may wish to find a willing volunteer to practice these techniques on. That hopefully shouldn't be too difficult. Okay, hello guys, welcome. We're going to look now at the massage techniques for tendon pain. We'll start logically down at the bottom of the body, and we're going to start with the Achilles tendon technique. When it comes to the actual tendon, what we want to avoid is any vigorous rubbing over the tendon. Because although some schools do suggest you can do some deep transverse friction over this area, I would advise against this because particularly with a reactive tendinopathy, you're only likely to irritate it further. However, massaging the connected musculature, the soleus and the gastrocnemius muscles can be very beneficial and from experience does lead to some significant pain relief from Achilles tendon pain. It's not a cure, but it can be an effective way of reducing pain, and even if that's a transient response, that can be very helpful for the patient and essentially builds rapport and gives you a buy-in for more long-term rehabilitation methods. Now, there's a recent study that came out that we're going to have a look at just here, and I'll put it on the screen and talk about it just now. So this study you can see on the screen came out in 2019. And what they did was they used pressure massage for Achilles tendinopathy, and it was a single-blind randomized controlled trial. There was a total of 60 patients with Achilles tendinopathy, and they were randomized into 3 groups. One group underwent the eccentric exercise protocol. The second group underwent the pressure massage with a physical therapist twice a week, 2 or 3 days between treatments for a total of 6 weeks. And the therapist used his or her knee to put pressure on the soleus muscle at 3 different locations. What's interesting is that the therapist used their knee to put the pressure on, which I should imagine might be a little bit painful, but apparently that's what they did. And the pressure was held until the pain started to decrease and the muscles started to relax, so a typical trigger point type mechanism. And in the third group, they underwent pressure massage and the eccentric exercise as well. Pressure massage is a useful treatment for Achilles tendinopathy. Compared with eccentric exercise treatment, pressure massage gives similar results. So that's interesting, and it supports the use of massage for Achilles tendinopathy, something which we know in practice works, but it's always good to have a study to back up what we're doing clinically. Okay, so let's have a look at some massage techniques. You can use anything for your massage medium. I tend to use a wax most of the time, and I'm just going to do some standard effleurage techniques here to get things warmed up, and then very quickly I like to get into something a little bit more vigorous, so some petrissage techniques as well. And when I'm doing this, I can have a feel around and get the patient to inform me as to whether there's any particular tender points, particularly when I get into frictions here. Typically when you apply more pressure, you're going to pick up some more tender points just by the very nature of the pressure that you're applying through the tissue. So as I do that, if I find a tender point, then it's an option to obviously work on that more focally with some kneading or some sustained pressure over that point. And the friction techniques as well can be very useful. So I tend to get stuck in fairly quickly into the muscle and to try and reduce any areas of focal pain or tension. And this can be very beneficial for reducing Achilles tendon pain. If you want to target directly over the tendon, you can do so, but you need to go very light, and you need to be approaching it from a neurological perspective in that you're trying to desensitize the tissue and not mechanically irritate the tissue for the reasons that we stated just a moment ago. So you can do this, and when doing this I like to use a massage tool, apply a little stretch through the tendon, and then just very gently glide over the tendon, and they call this technique feathering, which kind of denotes the amount of pressure that you're pushing through, and you're just very lightly moving over the tendon there. And with this repeated stimulation, you should get some light touch analgesia. And what I mean by that is the constant low-level stimulation should cause some desensitization of the superficial tissue, which then means when you then touch the area, which was once quite sore, it should feel less sore or even slightly numb to the touch. Again, this is only a transient response, but whilst the patient's with you and you're imparting all of your advice regarding what to do and what not to do and how to look after their tendon and the management plan, you may as well be doing some manual therapy, particularly if it leads to some symptomatic relief. They're going to be much happier when they leave the session and more likely to follow any of your future advice. So that's the light feathering technique over the Achilles tendon. Okay, just moving each side of the tendon, just moving very lightly. Just going to show you here. Up and down, repeating over the same area to get that light touch analgesia. Okay. And using the tool, there's nothing to stop you, of course, using that up the leg to do your massage techniques, IASTM, instrument assisted soft tissue massage. And it can have many benefits. Not only does the patient often like it and find it therapeutic, but it provides a different input than the use of your hands. Not a better input, just a different input. And if you're doing a lot of massage on a daily basis, even using this about, say, 10 to 20% can be significantly helpful to the fatigue that you may feel in your hands at the end of the day after doing lots of hard manual labor. Okay, so that was the Achilles tendon massage. We focus on the contractile tissue. We can go over the tendon, but only very lightly, and to try and desensitize the tissue. We generally try and avoid any vigorous frictions over the tendon, which can, of course, cause further irritation. Guys, in this video we're going to have a look at massage when a patient has patellar tendinopathy and the pain associated with that. So it makes sense here to massage the neighbouring musculature, the attached contractile tissue. So we're going to be working up around the quadriceps in order to get some pain relief around the knee. And this can work for many different knee conditions, so I'd advise you to try it for other things and not just for the patellar tendinopathy. We can start off, of course, with a general massage over the thigh. So I'm going to have a little go at doing that now. It's going to put a bit of wax onto our model's legs here. And we can start with some of your standard massage treatments over the quadriceps and some friction techniques, for example. If you're a massage therapist, of course, these are all things that you will already know, and the great news is you can simply apply those to the quadriceps and get some relief from the knee pain. But there's a little trick that I want to share with you right now, and that's that there's often a tender point, and I wrote about this in the book, and we spoke about this, I think, in one of the earlier lectures. There's often a tender point on the mid-lateral thigh between the vastus lateralis and the vastus intermedius. And there was a study done where they looked at this as a focal point of pain. It was a study looking at this as a fascial manipulation technique. And this area here was the CC point, the center of coordination. And the knee pain, the patellar tendinopathy, was the CP point, the center of perception. And this is a bit like the Trevelyan-Simmons trigger point theory, in that a sore bit here can be related to the pain down here. So if you treat one area there, you get relief of pain down here. Now, if you read the study, which I'll put on the screen now to show you, it's very interesting, and you can look at the technique that they used, and you can look at the theory behind why they think it worked. However, I'd advise you to try it in practice, as I have, because I do find that it works. And even if you're unsure about its potential mechanisms, if it works for your patient, then it's definitely worth a try. So what we do is, I'm just going to put the leg into mid-range here so that it's not a full quad stretch, but the leg's just off the side. I'm going to find that tender point. Okay, so I'm running up the lateral thigh, just off the vastus lateralis, vastus intermedius there. You may feel an area where there's an increase in tone, but you're often going subjectively by what the patient tells you. So if they tell you that they feel some pain at a particular point, which even, of course, healthy knees and healthy thighs will do. Okay, so I found a little band of tissue here. I don't know if that's relevant. I'm going to look up at Richard now and see if he's finding this uncomfortable. He is. Okay, right. So this is an area we can work on. If you're having a look at the study now, you can see that they use their elbow. That's always an option. It certainly saves your thumbs. Or you can, if you use massage tools, you can get in there and use one of those. And they did a combination of things from sustained pressure to transverse frictions as well. So what I like to do is usually go in there with my thumb As I don't do these too often, I can confidently do these with my thumb without worrying about overloading my thumb with constantly pressing on patients' thighs all day. And after some sustained pressure of up to a minute, and within that minute I'm looking for some pain relief, I'm looking for some analgesia. So I'm going to see if this is desensitizing with the sustained pressure, which it is, which is great. Okay, always handy when that happens on the video. And then we're going to go in and just do some friction work over there. You don't have to use a massage tool. I do like to use massage tools intermittently in my treatment. If anything, it's also a great hand saver. In practice, this is not what they do in the study, but in practice, I do like to do some more global longitudinal techniques over the muscle as well as focusing on that specific point. Okay. Once you've done that, you should have and find reduced pain from the knee, perhaps reduced pain with a squatting movement, or reduced pain with a passive knee bend as well. General quadricep massage should help to reduce knee pain from patellar tendinopathy and other knee problems. And there was that more focal technique where we're massaging this particular tender point commonly located in the mid-lateral thigh, which can help to reduce knee pain as well. So that's massage of the quadriceps to reduce pain for patellar tendinopathy. Okay, now it's your turn to give it a go.